Hello, my name is John Henry Anderson. I'm a physical therapist with APRS Physical Therapy West. Today I'm going to talk to you guys about orthotics, kind of why we would need them, and kind of go through what a temporary orthotic would be and what a custom permanent orthotic might be. Today I've got a patient here who is in need of orthotics, so I'm going to kind of walk through a little bit of the evaluation. Usually people who need orthotics are people who are complaining of foot pain, maybe bunions, maybe shin pain, knee pain, and through a biomechanical evaluation we can kind of determine whether orthotics will help to improve their daily functioning, maybe their sports, maybe make them faster, jump higher, run further, or maybe it's for work where they're on their feet all day and they need something to help support their foot during work. One of the evaluations we'll do is in a position where the patient's on their stomach, and basically what I want to look for is kind of to see where their talus bone lines up underneath their tibia. And so with my right hand here, I'm holding onto their talus. With my left hand, I'm trying to manipulate the foot so that the talus lines up correctly. And from there, I can kind of see how much tilt the rear foot has and how much tilt the forefoot has. So I know how to cast and then how to appropriately post based on that. I use traditional plaster. It's been shown to be a very effective and the more traditional way of being able to get a proper molding of exactly what the person's foot looks like. So I apply the first layer here, make sure I get a good fit over the foot, mostly the rear foot here. Make sure and get it all smooth as possible. And then I do the second layer. So then once I have the cast on, I want to hold them in that subtalar joint neutral position, and I hold this until the cast dries. So if we determine that an orthotic is the right treatment for you, then what we'll usually do is start with a temporary orthotic. I generally start with over-the-counter arch support like Superfeet. I find that this is a great company to start with. I love the fact that the bottom of this is nice and flat. That way I can manipulate it as I need to. If we go beyond the temporary orthotic and want to go to a custom orthotic, that's where the casting comes into it. So this is the slipper that we made earlier. So from this, we have a perfect mold of that person's foot. And then we will send this into the lab that I use from out of state. And what we get back is a very well-made permanent orthotic. This permanent orthotic should last you 10 to 15 years. So if you think orthotics might be right for you, please call today at either our east or west location. We have clinicians that are phenomenal at making orthotics and getting the right orthotic product for you. So visit us online at bozemanaprs.com.